Safety in first aid. Safety first. Safety on the road is more important than ever before because of the rapid increase in the number of vehicles. Read and follow road signs. They are meant for your safety. Always follow safety rules on the road and at home. However, sometimes accidents occur in spite of being careful. Here are ways to deal with some emergencies. First aid. First aid is the first medical help given to an injured person before a doctor arrives. For cuts and scratches. Do not neglect any wound, however minor. Germs can enter a body through uncovered cuts or wounds and cause infection. Wash your hands before giving first aid, as germs from dirty hands may infect the wound. Wash away all dirt around the wound. Clean the affected area with cotton wool soaked in an antiseptic solution. Place a thick pad of cotton wool or sterile gauze on the wound and press it with your thumb and fingers. This will stop bleeding in most cases. A tourniquet can be used. This is a bandage tightly tied over the wound to stop bleeding. When the skin is cut by a dirty or rusted object, germs may enter and cause a dangerous disease called tetanus. Consult a doctor for an anti-tetanus injection. Fact-wise. The clear gel of aloe vera can heal wounds and burns by forming a protective coating on the affected area. For nosebleeds. Keep the patient upright in a comfortable position with his head held back. Press the bleeding side of the nose firmly. Keep an ice pack or wet cloth on the nose and the head of the patient. Ask the patient to breathe through his mouth and not to blow his nose. A little bit of bleeding from the nose is harmless, but if the bleeding is heavy, send for the doctor. For sprains. When the tissues around a joint get torn, we call it a sprain. Sprains cause swelling and sometimes discoloration of the skin. They are very painful. Keep on applying ice packs or ice cubes on the injured joint till the swelling subsides. For fractures. A crack or a break in a bone is called a fracture. Keep the patient calm and comfortable, and send for the doctor. Apply a splint to give support to the broken bone and try to avoid unnecessary movement. Any easily available article like sheets of newspaper, a piece of cardboard or a pillow around the injured bone can act as a splint. This will prevent movement and help the broken bone to heal. A sling made from a triangular piece of cloth can be used for support. For burns. One can suffer burns from hot objects, fire, steam, boiling water, crackers, electric points and chemicals like acids. Minor burns. Though minor burns are very painful, they can be treated at home. Let running cold water flow over on the burn until the pain subsides. Apply an antiseptic lotion or cream to prevent infection. If an antiseptic lotion is not available, apply a paste of baking soda and water. Severe burns. Sometimes the skin gets severely burnt and blisters are formed. Never try to prick a blister. An open blister is an open wound. It can catch infection. Gently cover the burn with a clean piece of cloth or sterile gauze to protect it from germs and dust. If the victim is in a state of shock, give him a warm drink. Never try to give a liquid to an unconscious person. Dip a sterile piece of cloth in a solution of baking soda and use it as a wet compress. Severe burns must be treated by a doctor. Chemical burns. Remove any clothing from the affected area. Use plenty of water to wash off the chemical. For firefighting. In case there is a fire in a building, inform the nearest fire station. In case of fire caused by petrol, do not throw water on it. This is because petrol being lighter than water floats above water and keeps burning. Put out the fire by throwing lots of sand or mud on it. If a person's clothes catch fire, do not allow him to run around in panic. This fans the flames. Make him roll on the ground. Cover him with a thick blanket. This can put out the fire by cutting off oxygen. If a fire has been caused by defective wiring or an electric gadget, do not throw water on it. This can cause electrocution. Immediately turn off the main switch. Smother the fire by throwing sand. Use a fire extinguisher. For animal bites, wash the wound with soap and water to remove germs, as the virus which causes rabies or hydrophobia may be carried in the saliva of an infected animal. Dogs, wolves, bats and cats are known to carry the rabies virus. Apply an antiseptic lotion to prevent infection. Bandage the wound and rush the victim to a doctor. For snake bites, a poisonous snake injects poison with its sharp fangs, causing a lot of pain and swelling. Treatment must be given immediately as the poison can kill. Apply a tourniquet just above the bite to stop the flow of blood to the heart. This may help to slow down the spread of the poison. Immediately rush the victim to a doctor. It is always better to take precautions when you walk through areas where snakes are found. Wear high boots to protect your feet. Do not use medicines which have crossed their expiry dates. For poisoning, certain household items like nail polish, naphthalene balls, paints, detergents, and some medicines can be poisonous. Always remember safety rules. Keep all medicines locked, away from the reach of little children. Read medicine labels very carefully before taking any medicine. Safely throw or destroy expired medicines. Properly wash vegetables and fruits before eating them as they may have been sprayed with harmful pesticide. In case of any kind of poisoning, try to make the victim vomit. Rush the victim to a doctor. A call away. Keep emergency contact numbers for the nearest police station, fire station, doctor, and chemist handy for immediate help in an emergency. Words to know. Ice pack, a bag filled with ice which is used to cool parts of the body. Discoloration, change in color, here, skin turns blue. Fracture, a crack or a break in a bone. Splint, a piece of wood or cardboard used to hold a broken bone in position. Sling, A bandage passing over the shoulder to support an injured upper limb. Quick recap. Help given to a patient before the arrival of a doctor is called first aid. We must obey safety rules on the road and follow road signs. Never neglect a wound as germs may cause infection. Any unnecessary movement of a broken bone should be prevented. Treat a burn by washing it with running cold water and applying an antiseptic lotion. Cutting off the air supply helps to put out a fire. Snake bites must be treated immediately. Properly wash vegetables and fruits before eating them. Cover the burn with sterile gauze and send for the doctor.